Come on, walk in. Okay.
Right there.
Okay. All right. Hello. How you doing today?
Good.
I understand you're here for an assessment today.
I guess so.
Okay, and tell me your name.
Shamar.
Hey, Shamar, and how old are you?
17.
All right, you're 17 and you're here for your head to toe assessment. Okay, so with the head to toe assessment, we're going to be doing a few things, but I'm going to go ahead and sanitize my hand first, okay? All right, so with the head to toe assessment, we're going to be doing a few things. We're going to be going into a little more depth than what we did before, okay? But it doesn't mean that anything wrong. We're just doing a little bit thorough only compared to what we done last time, okay? Okay, can you tell me who's the president?
Donald Trump.
All right, good. And I see that you came in, you dressed appropriately, you clean. Or do you have access to 3 meals a day?
Yeah.
Okay, are you normally a happy person?
Mm-hmm.
Okay, and your mood is good? Do you feel good?
Yeah.
All right, do you don't have any other problems or anything? I see you walked in. When you walk in, your gait was pretty steady, upright. I see your posture is good. You're upright. You're straight. You sit up good. Do you use any type of assistive device to when you walk? No canes, no walker, none of that. Okay then. And English, is that your primary language?
Yes.
Okay then. All right then. So now we're gonna go ahead and get started. Okay. All right. Okay. Right now I'm gonna go ahead and give report to on a 17-year-old male that came in for his head to toe assessment on today. All right, I'm gonna give a report on a 17-year-old male that came in today for a head to toe assessment. I noticed when he came in, he was alert, oriented times 3. He was his stated age. His weight appeared to be appropriate. His BMI appeared to be appropriate for his weight. Excuse me, y'all. It seemed to be appropriate for his weight. He stated that he had 3 balanced meals a day. His posture was straight. He was erect. He was comfortable. His primary language is English. He had no involuntary movements when he walked in. He walked in with a straight gait, no swerving or inappropriate movement that was done. He denies having to use any type of assistant devices to walk with. He was friendly. He said he was in a good mood. His speech was clear. He was appropriate. His facial expression was on cue with the subject that was at hand. I assessed his skin. His skin was nice and warm, dry, intact. There was no lesions, no scars noted on his skin area. His color was appropriate for his race. Then I went down and I assessed his hands and his nails bed. His hands was nice. His hand grip was nice and strong. His nail beds was nice and pink. Capillary refill was less than 2 seconds. There was no lesions or anything noted to his hand. His peripheral pulses, his radial and brachial pulses were strong and equal bilaterally. Then I went on down and I assessed his head and his scalp area. His head and his scalp. His head was nice and clean upon inspection. No lumps or no tenderness noticed to palpation. His scalp was clean. His okay, that's it for that part. His no tenderness, no that. His scalp was clean. Then I went down and I assessed his face. Okay, his face was symmetrical. with no weakness or no involuntary muscles. Cranial nerve 1 through 12 was all intact, and no thrills or anything, no thrills or tenderness noted to his temporal arteries. No, it was palpable. Then they was all equal. His also equal and palpable was his maxillary and frontal sinus, non-tender there as well. His TMJ articulates smoothly. His neck, I moved on down to his neck. His neck is symmetric with no masses or tenderness. No pulsation noted. His lymph nodes was all palpable and non-tender. His carotid arteries was all palpable and auscultated bilaterally, and they was all equal. No thrills or bruit noted there. His neck was cranial nerve 11, which is the full range of motion was assessed. He had full range of motion in his neck area. His trachea was nice and midline. I moved on down to his eyes. His eyes was nice and clear. No drainage noticed to his eyes. His eyebrows, his eyelids was nice and symmetrical. No scars or anything noted there. There was no redness, no edema noted. His conjunctiva was pink. His sclera was nice and white. His cornea was nice and clear. His cornea was nice and clear. His pupilla was, which is his pupils, was round and react to light and accommodation. Then I moved down to his ears. His ears was without lesions, without drainage, no scarring, no discharge. They was not tender to palpitation. His canules was clear. He was able to hear with a whisper with no problems bilaterally and equal. His nose was intact. His nose was nice and symmetrical it was no tenderness. His nares was palpable. His mucosas was nice and pink. His spectrum was midline. There was no sinus tenderness. His lips, I moved down to his lips. His lips was nice and pink and intact, and no lesions, no cracks noted to his lip area. His mucosas was nice and pink. His gums was nice and pink. His hard and soft palate. His tongue was nice and midline. They was without any drainage or anything noticed. They was nice and moist. His tonsil was nice and clear. His thyroids was palpable and non-tender. Then I moved to his lungs next. His lungs was they was erect. His to A, P, and T diameter. He without tenderness. His scapular and spine was nice and midline. His respiration rate was nice and even at 18. No accessory muscles was used. His lungs was auscultated anterior and posterior. To auscultation, they was clear. His CVA tenderness was negative. CVA tenderness was negative. Okay, then I moved down to his heart. His apical pulse was assessed at the fifth intercostal space on the left side, right at the mitral valve. His apical pulse was right at 74. His heart sounds was heard, S1 and S2, no gallops, no murmurs, and no rubs was heard. His abdomen, with upon inspection, was nice and flat, smooth. His skin was intact. His umbilicus was midline. There was no lesions, no scars, no striate noted. No masses or tenderness was noted. His bowel sounds was present. Time 4 quadrums. His tympani was negative, and I said his umbilical was midline. His upper and lower extremities was all intact, nice and strong. His peripheral pulses to his lower extremity was his femoral pulses, his popliteal pulses, his post-tibia pulses, his dorsalis pedis pulses was all equal and intact bilaterally. His skin distribution to his lower extremity was intact, no scars noted. His heel to shin assessment was equal and bilaterally. His Romball test was negative without any swaying. The patellar reflux test was positive 2+. Anterior and upper and lower extremity, he had all range of motion was nice and strong. His the scoliosis test was negative. His shoulder height, his scapular, his iliac crest, his gluteal fold, and his elbow gap was all symmetrical and intact. This completes my head to toe assessment for today. Thank you.